Welcome to Community Blue, a new innovative way to get the best care from some of the best healthcare providers in the Baton Rouge area. In this video, I'll show you how your plan works. Community Blue is a patient-centered health plan. That means you have a special network of doctors and a dedicated health support team providing care centered on you. But before you go to the doctor, stop. Community Blue has a much smaller network than you may be used to with other plans. See the Community Blue provider directory to make sure your doctor is in your network. If you don't find your doctor there, you'll need to select a new one. You can access our provider directory online anytime at the web address on your screen. To get started, you need to select a primary care physician. This is the doctor you see when you're sick or hurt. This doctor will lead your care team and get to know all of your health needs. Remember, if you don't choose a primary care physician, we'll choose one for you to start out, but you can choose another at any time. It's very important to use providers in the Community Blue network. If you visit providers not in the network, you will pay a lot more out of pocket. When you see a network doctor, you simply pay a small deductible and your visits are covered at 100%. But if you visit a doctor not in your network, you'll pay a deductible and 40% of the doctor's bill, which could add up to hundreds of dollars. Out-of-network doctors can also bill you much more than your insurance plan pays, and you are responsible for the difference. So why pay more? With Community Blue, hospital services at Baton Rouge General are covered at 80%. But if you go to another hospital, your plan pays only 60% of the cost, and you pay the remaining 40%. This could leave you paying thousands of dollars out of pocket. Also, when you go out of network, your plan pays only a percentage of the allowable charge. The allowable charge is the amount doctors and hospitals have agreed to accept as payment in full for care. Doctors and hospitals outside of the network may charge you more, so again, stay in network and you'll save a lot of money. Of course, when you have a medical emergency, go to the nearest hospital and your plan will cover your care at the in-network level. Once you're in stable condition, be sure you're getting the best care from your health team. If your doctors think you're up to the move, you may be asked to transfer to an in-network hospital, and this won't cost you anything extra. Our goal is to keep you healthy. Take advantage of the wellness benefits available to you. Your handbook has a list of tests, checkups, and exams covered at 100%, like your annual physical. When you get your annual physical, your plan pays the entire bill. You don't even pay a copay. Your plan also includes great discounts from these wellness vendors. And check out our Healthways program, giving you access to a network of gyms for just $25 a month. You can look up all of the discounts available to you at the web address on your screen. All Community Blue members enjoy prescription coverage through a select group of network pharmacies. When you go to a network pharmacy, you pay only the copayment. Or you can fill your long-term prescriptions through our mail-order pharmacy, Express Scripts, with one convenient copayment. Copayments vary depending on the type of medication you take. Check your Community Blue plan for details. And remember, you will always pay the least when you ask your doctor for generic medications. With Community Blue, we've got you covered.
Welcome back. This is Kyle again with Van Vliet Insurance Agency here in Richmond, Indiana. And today we'll be talking about your plan options in 2014. This year you have basically two options. Every option will fall into two categories, either ACA compliant or non-compliant. If the plans are ACA compliant, it basically means that there will be no fine that you'll be subject to. If it's non-compliant, you will be subject to the fine. If you're not sure what the fine is, check out my other webinar entitled Penalties. We're going to look at the ACA compliant plans today. These are plans that abide by the Affordable Care Act or Obamacare. These all have all the essential health benefits, no pre-existing conditions, guarantee issue, the whole 9 yards. When you're looking at compliant plans, within this category you have two options, either on exchange or off exchange. Again, whichever way you decide, you're not going to be charged a penalty for. If you're on exchange and you qualify for subsidies, you can utilize your subsidies on exchange. If you're off exchange, if you buy an off exchange plan, you cannot utilize subsidies. If you're not sure about your subsidy, ask your agent. They'll be more than happy to walk you through a quote to see if you might qualify for subsidies or not, and what the subsequent price of the policy would be. In Wayne County, Indiana, which is where we're located, we have one option on exchange. That's Anthem right now. Anthem in our area has some pros and cons. The pros being cost. With or without subsidies, Anthem's a little bit cheaper than the off exchange. With subsidies, they can be substantially cheaper or free. The problem is, the cons on Anthem is that their network's really poor. In 2014, Anthem set up their own HMO network called Pathway X just for these specific on-exchange plans. And that HMO network is very restricted. Around here, we get into issues with our local hospitals and some of the doctors that are out of network. And it kind of forces people who decide to go this route to have to go to outside areas, Henry County and such. Off exchange, the plans actually look quite nice in terms of their benefits. The networks, we have two options. One is Assurant Health, which utilizes the Aetna network, and Humana, which utilizes their own Humana network. Both networks are quite a bit better than Anthem. Assurant being the better network, Reed is in network and all the local doctors. Humana, not quite as good as Assurant, but Humana has a nice feature with their catastrophic plan. It's quite a bit cheaper. And so for people who qualify for catastrophic plans, those under the age of 30 or who have a hardship exemption, who qualify to take out a catastrophic plan, Humana can be a better option. Then we come over here, quickly touch on non-compliant plans, and those plans are non-major medical plans. So any major medical plan that is not ACA compliant, for the most part, they've been done away with. So you're looking at non-major medical plans, short-term health insurance, which in the state of Indiana and Ohio, you can take out for 6-month periods, but the problem is, every 6 months you have to reapply, and so you have to go back through medical underwriting. If you have a bad condition that developed, you might not get accepted back. So beware of the short-term policies because of that. The other major non-compliant plan would be an indemnity-style plan. Again, premiums are nice and cheap. They're relatively easy to get. The problem is they have a per-claim limit. So you might have something like a $2,000 per day hospital limit, which for a standard stay at the hospital might be sufficient. However, if you also have heart surgery during that stay, you might miss your limit and be out of pocket quite a bit. So those are decent options for some people, but just keep in mind they are limited in terms of their benefits. So, this was Kyle with Van Vliet Insurance. Thank you for watching.